Hi, I'm Dr. Zachery Smith, and your dog's been diagnosed with Brachycephalic Syndrome. Brachycephalic Syndrome is a condition that we see in bulldogs and pugs. It's in the dogs that have those smush faces. To get them to be super cute and have that kind of small nosed face, what we had to do was take a dog that had a normal size muzzle and breed them to make it shorter and shorter. What that did was it changed kind of the bony conformation of the nose, but it didn't take away all that soft tissue structures that are within the airway itself. So these dogs tend to have a redundancy in tissue within the airway. And that's why they have issues with breathing, and it's why they typically have that snorty sound when they breathe. There's kind of two classes of patients that we'll see this in, or when we're going to consider surgery in. One is those young dogs. So it's the dog that already has that really snorty nose or sound to its breathing. It's got that narrowed nose, those narrowed nostrils, but it doesn't necessarily have clinical signs yet. In those dogs, what we're trying to do is prevent clinical signs from developing. So we're trying to take away the problem so that hopefully they'll have a normal life with normal activity. The other group of dogs that we'll see this in are the older dogs. So they could be 2 to 12 years old, and they're seeing those secondary ramifications of having a chronically narrowed airway. So they are coming in respiratory distress, they're having problems breathing, they don't have any ability to tolerate exercise, those types of things. With either one of those dogs, we're most commonly doing a very similar procedure. What we're going to do first off is we're going to open up that airway. So if we can open up the nostrils and make those wider, what we'll do is we'll open up that pathway of air and allow for less resistance, so easier flow of air through the airway. The way that we think about that is if you think about breathing through a straw or a snorkel, there's a lot of effort you have to do to get air through that. So if we can open up the airway, then that allows us to breathe much easier. So to do that, we do what's called a rhinoplasty. So we essentially come in and we make little cuts in the nose and we move the tissue out so that it allows that nostril to be wider. The next thing we're going to do is actually look in the back of the throat. In the back of the throat, what we most commonly see in these pets is what's called an elongated or redundant soft palate. So if you put your tongue to the top of your mouth, what you'll feel is your hard palate, and if you move to the back, it will turn into soft tissue. That's the soft palate. And the soft palate in these brachycephalic dogs tends to be long and floppy so that it actually impedes the ability for them to breathe. If that is the case, which it generally is, we'll go in and we'll trim the soft palate off and we'll suture it back together so that it's much shorter and resembles more of what we'd see in a normal dog. We'll also assess the airway down a little bit lower, so the voice box or the larynx. What we're assessing there is to see if there's any what are called saccule eversions. So down by the vocal cords themselves, there's these little pockets of tissue that can evert out and actually poke out into the airway and narrow that airway down. If that's the case, we'll trim those off so that those aren't ballooning out into the airway anymore so that we can open the airway. Again, all of these techniques are intended to open up the airway and reduce resistance to flow through that airway to allow them to breathe better. Within the larynx, the last thing we're going to assess is to see if they have a laryngeal collapse. The laryngeal collapse is kind of its own unique problem, but it is secondary to brachycephalic syndrome. Essentially what this is because you've been breathing through that narrowed straw for so long, think about breathing through a straw, put your finger on the end and take a breath, and what you'll see is the straw will collapse. That is essentially what's happening with the larynx during the laryngeal collapse. Now that voice box is starting to collapse down on itself. That's a very, very serious condition that requires surgery, potentially multiple surgeries, and can have a pretty guarded prognosis. Now that's only a condition that's seen in very few dogs, so I don't mean to talk about it in a way to scare people, but I always like to mention it because it is something that we are going to assess to make sure that we do address it or talk about it if we do identify that during the procedure. Most commonly, if we do have laryngeal collapse, we have other clinical signs that are pretty significant. These are the dogs that have to have a toy in their mouth when they're sleeping, because if they close their mouth, they have sleep apnea, they don't breathe, they can't breathe through that airway anymore. These are the dogs that have complete activity intolerance. They can't even go for short walks without going into big panting episodes and respiratory distress. Brachycephalic surgery usually goes quite well, but it can have some pretty significant and even fatal complications. Those complications, when they become fatal, most commonly are associated with what's called aspiration pneumonia. Aspiration pneumonia is where you actually regurgitate or vomit material out of your stomach and then breathe it down into your airway and into your lungs. And that creates a lot of inflammation and a bacterial infection as well. The reason that brachycephalic dogs are predisposed to that happening is a lot of these dogs already have regurgitation going on. And that actually is part of the brachycephalic syndrome. They can have changes to the outflow tract of their stomach, or they can have what are called sliding hiatal hernias, where that stomach is actually moving into the chest because they're breathing so hard to try to breathe air in that the stomach actually gets pulled in just like the air would through the upper airway. We try to do our best to prevent aspiration pneumonia from happening. The way that we do that is we give them anti-nausea medications preoperatively. We use medications that tend to limit nausea and vomiting. And then we control the airway with a tube, an endotracheal tube, that allows us to protect it for as long as possible before we wake them up. When it does happen, it can require emergency care, transfer to an emergency hospital for 24-hour oxygen therapy, and can be even fatal. Again, it's a rare condition, so I don't need to scare you with this, but I always do like to mention it as a possibility. Probably the more common complication that will happen is complications with the incision on the nose. When they have incisions on their nose, they love to paw at these, they love to rub them on the ground because they itch. So we do send you home with the terrible cone of shame or an Elizabethan collar to try to prevent that, but we do have to be pretty diligent to make sure they're not flattening the cone on the ground to rub their nose or getting around the cone with their hands to scratch at the nose. Most commonly, if they do have incisional complications with the nose, it's just something that heals on its own. We don't commonly have to do revisions on these because the nose is such a highly healing area of the body. But it can result in little pink colored abnormalities within the nose long term. So obviously we do want to try to prevent this complication from happening. Post-operative care for these guys essentially is wearing the terrible cone of shame for 2 weeks and having pretty significant activity restrictions. So we don't want them running, jumping, or playing, things that will increase the inflammation in their airway. We want them confined in a single room in the house, and we want to be on leash every time we go outside. When we go outside on leash, we do recommend using a harness for brachycephalic dogs so that we prevent any pressure on the airway that could cause narrowing. So a collar can put a little bit of compression on the airway, and in patients that already have a narrow airway, it's best to just be overly cautious and use a harness for life. The other thing that they will have to do is they won't be allowed to have toys for that first 2 weeks so that they don't traumatize the incisions within their mouth, and they'll have to eat soft food. So no kibble, no chew toys, nothing like that. Soft food can be either purchased at the store in a canned food type, or you can soak their kibble for 10 to 15 minutes in water before you feed it to them to soften it. We have you come back at the 2-week mark and we take a look at the incision, make sure everything is healed, listen to the lungs, do an assessment. At that point, as long as everything is healed, the cone of shame will go away and your pet can resume their normal life. Now, we do recommend that you avoid the hottest times of the day, so don't bring them out in the 110-degree weather for life, just to make sure that they're not putting excess stress on their airway, and don't over push these dogs. Those are really the only 2 limitations long term. We do expect these dogs to have a normal, active lifestyle. They will never be a normal dog, but as far as their respiratory tract, but they should be a very active, healthy dog long term. That's most of the information that we need to discuss about Brachycephalic syndrome. If you have any additional questions, feel free to contact your primary care veterinarian, or schedule a telecommunication consultation with me. Thank you so much for your time.